So video 2, looking at the trigger points of the neck, things that you would need. I mean, there's a variety of positions that you can be in with this, standing, using a ball in a sock. So you find a ball that you like. A tennis ball would put you sort of in the middle of hardness, and then you can get really soft squidgy balls from, the toy shops that cost relatively, just a few dollars, and then you can go for really hard ones, and you just find, there's different balls for different muscle texture. So if you're in a lot of pain, then you might go a little bit softer. If you feel that, it's deep muscle like glutes and trapezius, you can often go harder because you've got depth of muscle there, and actually the muscle really likes the pressure. So it's really trial and error. So I would recommend having at least 3 or 4 different balls, all of different firmnesses. And generally with trigger point balls, you want smooth texture. You want, if I take this one, or here's one here, smooth texture, almost like skin texture, rather than the spiky balls, which are going to be more diffuse. You want direct pressure onto the trigger points, which are the nerves coming into the muscle that get blocked and congested, and the area around them. So you really want something that's going to apply pressure, and it's called ischemic pressure, where you cut off the blood supply, and that allows the reflex in the nerve and the muscles to release. So a head jog, a spiky ball, is not going to be quite so effective. So, you want a ball, a couple of balls. You maybe want a long sock with a ball in the end. If you've got anything, like nobblers, so this is a nobbler that's got 4 different ends. So you can get these in all sorts of shops, and they've got a nice round end. So they apply the pressure that a finger would apply. Here's another one which looks a little bit like one of those knuckle dusters, so you can hold it on the inside, or you can hold it on the outside, and then you've got your trigger pressure gun there. It's like a gun, and that saves your fingers, because if you use fingers are going to get tired quite quickly. Maybe you're going to have a pillow for your neck. So today's class is trigger points, and we're just going to just start with a general overview, really, and that is that when you've got neck pain, it's very rarely the muscles of the neck that are causing the neck pain. More often, it's going to be coming from the shoulders, the trapezius, the upper back muscles. If you've got pain in the skull, it's coming from the neck. So it's referring upwards. So shoulder girdle muscles referring pain into the neck, tight neck muscles referring pain into the head, causing headaches and a whole load of problems. So there's a certain order to look at things. I'm going to go, I've got my little idiot sheet here just to remind me of where I'm going with this. But to start with, if we're just going to begin with, we'll look at the muscles that radiate pain into the neck, and then we'll see if you can find time to see the muscles that radiate from the neck into the head as well. So the main muscle group that we're going to look at when we're looking at neck stiffness, sometimes you've got stiffness but no pain, that would point you towards trapezius. So trapezius, if you go, you go to the top of your spine, the back of your mouth, out to the peak of the shoulder, down to the bottom of the rib cage, in the back of your body, there's trapezius. So it's a trapezoid-shaped muscle. It's got lots of trigger points. So the first trigger point is one that we instinctively know about, and we tend to go there ourselves, and that's when we just sort of try to create self-massage in the muscles that run from the shoulders up into the neck. So trigger point 1, if you look at where your neck is and where the shoulder comes into the neck, if you just come out from the neck slightly and put your thumb at the front of your trapezius, if you lift your arm up, you'll feel this muscle lift up, become more active. Put your thumb at the front, and then 2 fingers, 1 and 2, at the back of the shoulder. So I always call this the snake bite. So it looks like a biting sort of implement. And you're going to press your thumb into trigger point 1 at the front, and you're going to press your first finger and your second finger into the muscle at the back of the neck. So it's going to be really uncomfortable. I think 99% of the population have got active triggers in this place because we're very active in our arms and our shoulder girdle, in our neck and our head movements. So you're just going to grip the muscle and you're just going to go to the point. So you want to be about a 6 out of 10 in pain. So don't go too, don't grip too much and make it agony. So the trapezius muscle is going to feed pain, stiffness into the neck. You might also feel pain in its satellites, which will be sometimes behind the eye, sometimes in the ear, sometimes in the jaw, the chin, the back of the skull, the top of the skull. There's a whole load of satellite areas that you'll feel through this nerve pathway. So also trapezius can cause dizziness, it can cause imbalances, problems with balance. It can be misdiagnosed as vertigo and Meniere's disease. A whole load of balance issues can be misdiagnosed from active triggers. It can cause nausea, a whole load of things. So just always keep an eye on tightness in the shoulders running into the neck. So another way you could do this is you could get your ball in a sock and you could put it behind you, if I go sideways, and you could lean into a wall. So imagine the edge of the door behind me is a wall and you're leaning into the ball and you just pull on the sock just to make sure the ball stays where you want it to be. Okay, so what you do to one side, you're going to do to the other side. So another method, we'll just jump out of triggers here slightly. And in Feldenkrais, quite often what they do is a slightly gentler approach, in that you get your snake bite, you grab the muscles, and then you're gently lifting upwards. Just pulling up gently, and low effort. So you're talking about 2 out of 10 in effort. And you just feel the stretch of your trapezius as you pull it up, away from the collarbone and the top of the shoulder blade in the back. And you're just using the gentle pressure to send messages through the fascial system to the brain to let go. So the fascial system is it's highly innervated, it's full of nerves and blood vessels, and it's just talking to the brain through the nervous system. And so as you just gently lift that muscle, you'll start to feel the muscle release. So the trigger point work you do for about 30 seconds to 90 seconds, depending on how painful it is. So if it's very painful, maybe you do it for 1.5 minutes. And the same with the Feldenkrais, you're lifting until you feel the muscle just let go. So if you take your hand away now and you just feel that muscle, you can feel immediately that the tone of the muscle has changed, it's softer. So sometimes with the lift, you might need to repeat that a couple of times. So I'm going to the other side, I'm finding my 3 trigger points, I'm just gently lifting the muscle. So I always joke that this one's a bit like a dog with its puppy, and it grabs it by the back of the neck and it lifts it up until it stops squirming and wiggling and being naughty. As soon as it submits, then the dog puts the puppy down and the puppy's learned its lesson. Well, this is just a similar thing in that you're just talking to the nervous system, you're just trying to get that overactive, overstimulated, tight muscle just to yield, to let go, and to relax. So when I do this to myself, I usually find 4 times, twice on each side, and so I go back to this muscle, do it a second time, and the trapezius here at these 3 triggers has let go. Okay. So 30 seconds. So this is something you can do little and often through the day, rather than just once a week. These muscles are going to keep on becoming overactive and over tight. Things that can make these triggers really active is if you've had a bad cough, if you've had a virus, if you've had some sort of stress, these sort of things can really overactivate these muscles. Hangover, whole load of things, sleeping badly with your neck in a funny position. So, you know, if you feel the tone of the muscle now, it's much, much softer. So we can tell a lot through the nerves in our hands about the tone of the muscle, and we can feel those knots. So the next trigger point is going to be out on the peak of the shoulder. We've jumped ahead a bit to trigger point 6 because I'm working downwards. So trigger point 6, if you feel the back of your shoulder blade, where it comes into the shoulder, and then feel your collarbone where it comes into the shoulder, right into the edge of the shoulder there, there's a little indentation. And if you were to get your finger in there and just sort of wiggle around, you'll find there's a tender spot in there. So you could hold your shoulder and you could just to steady the hand, and you could use your finger to get in there. You could use, you know, if you want to use your nobbler, you can use that to get in there. Another way to get into this one, I'll just show you, it's not so easy in the studio, but you could put the ball in that place and you could lean into the corner of a wall. So if you've got a wall with, you know, an edge going this way and an edge going that way, so a door frame is a pretty good way to go. Put your ball in that, on that trigger point. You can put your head in the door frame and you can really apply pressure into that trigger. Okay, so that's another way to get into that, to save your fingers. If you're using fingers, if you do your lucky finger, you cross one finger over the other, that strengthens the finger that you're using, so it's not bending so much, so that you can apply a little bit more pressure. You can lift the arm up, just find, you'll feel the groove a little bit more with the arm lifted, and you can just get in there. You can try your thumb. And if you're fairly tight in your shoulders, you're better off using the ball against the wall or into the door frame. So again, you know, this trigger point is usually quite active. So if you think about the trapezius coming down from the neck, attaching to the edge of the shoulder, you know, there's a lot of movement there. There's a lot of work going on there. Sometimes you'll notice with the trigger point that you struggle to find the trigger point, but as you stay there, the superficial layers of the muscle start to relax, and then you suddenly go deeper, and then you find your trigger. So just, you know, give it a good 30 seconds and just see if that is working for you. So then change to the other side. So you find your collarbone, you go into the shoulder, you find the top of the shoulder blade, you find the little groove as far out as you can on the shoulder. If you need to lift your arm up to help you find the groove, you're going to do a lucky finger, you're going to cross one finger over the other, and just poke around until you find that point of tenderness. So I find for me, a lot of my issues are on the left side of my body. So just pressing, you're either pressing down, or you could be pressing into it and then pulling off of it, depending on how painful it is. You could be doing a circle. Let this arm be passive, don't make it active. Once you've lifted up the arm and you've found the groove, then just let this arm rest. You could turn your neck, so where the pathway is that this nerve is feeding into, up into the neck. If you move your neck, you're going to just help the process. Okay, so again, little and often, you're using your opposite arm. You can't do it with the same side arm. And if you wanted to, you could get the ball in the sock, put your head into a doorway and use the door edge to really get into that trigger using the ball and the sock. So trigger point 1, 2, 3, trigger point 6. So think about the inner edge of your shoulder blade, and then you've got the spine of the shoulder blade going across. We often think that what we feel is the spine of the shoulder blade is the top, but the top of the shoulder blade is higher up. So if you feel the spine of your shoulder blade, you'll feel it cuts across at an angle. You want to be sort of just above where the spine of the shoulder blade is, but then come off the shoulder blade and into the flesh that's just on the inside, between the shoulder blades and the spine. So you're right on that inner edge of your shoulder blade, you're slightly above the spine of the shoulder blade, and you'll find a tender place in here. So, you know, this is always pretty active as well. I really think that, you know, all the triggers in trapezius are going to be quite active for most people. So just breathe. So again, you could use your knobbler. If your fingers are getting tired, it's a little bit more direct, a little bit more acute. You could get your ball in the sock at the back of your body and lean in. So imagine the edge of the door frame behind me is a wall, and you're leaning into the wall to apply pressure. You could also, in this place, you could also lie down with your head on a pillow, and you could put a free ball just into, so if I show you, you could just put a free ball into that place and lie on it. And when you're lying down on the floor, you can do some arm floats, you can move your head, you can do arm circles, elbow circles, just to get in there and, you know, use a bit of movement, because then you're working through the myofascial system to help to speed up that release. You can also just hold the ball and press the ball into that trigger. So you could support this arm and just apply pressure with the free ball in the hand. That gives you a reasonable amount of pressure. So, you know, you vary it. So I'm going back to the knobbler because that's pretty good. Gets right in there. Okay, so 30 to 90 seconds. If it's really acute, you're going to get to 60 seconds. And then you're going to press a little bit harder, and your pain will go up again, but then it should start to subside quite quickly. So if it's subsiding after that 60-second point where you're pressing hard again, then you know that you're releasing that reflex in the trigger point. And if it's still quite acutely painful, you would stop, you'd go away, and you'd maybe try it again later in the day. So other side, you find the spine of the shoulder blade cutting across. You come outside of the shoulder blade into that inner edge between the medial border of your shoulder blade and the spine. And you just find the flesh there, deep flesh, and, you know, just above the level of the spine of the shoulder blade. And you'll find that really tender spot quite easily. So you can use your fingers, but cross your fingers over to give support to that lower finger that's applying pressure. You use the ball in the sock, you use your knobbler. If you haven't got a knobbler, you could use a wooden spoon, anything that's got a rounded edge. You don't want anything that's sharp or blunt, but a rounded edge is quite good. It sort of copies what your finger's doing, and just to apply that pressure to cut off the blood supply to that nerve and just release the reflex. Okay, so the next trigger point is, if you go back to the other side, you've got the spine of the shoulder blade cutting across. You want to come onto the shoulder blade where the spine is, maybe come in about 2 fingers, and then go just below the spine of the shoulder blade. So you're below the spine, you're on the flat plane of the shoulder blade. So you're about 1 finger in and about 2 fingers down from the spine of the shoulder blade, and you'll find another trigger point there. So again, you could use your knobbler. So as you go lower, it's going to get harder to get to. So again, you could use the ball in the sock. Imagine the edge of the door is the wall, and you're just leaning into the wall. That's going to give you a really nice pressure. You're holding the end of the sock so it doesn't fall away. You could lie on your back, and you could put the ball, so if I show you with the ball, below the spine on the flat plane. I have to do it this way. So it's on the shoulder blade, 1 finger in and 2 fingers down, and you just move that ball around. You're going to find your trigger point there. So just to save time now, because we've got a lot to cover, you could stop the video at this point and you could just do the other side and just make sure that side is well taken care of. So the next muscle group that we're coming to is levator scapulae. So levator scapulae tells you exactly what the muscle does. It lifts the shoulder blades up. Okay, so levator scapulae is attached to the top 4 cervical vertebrae in the neck, and then it comes down either side and it attaches to the upper edge of your shoulder blade. So if you take your opposite hand across, you'll feel that there's a slightly diagonal angle of the shoulder blade. So the shoulder blade comes up vertically, and then there's a bit of an angle that cuts across, and then it levels out to make the top of the shoulder blade. So where that angle is, you can feel with your fingers, there's deep flesh there. If you feel the muscle there, that's where trigger point 1 is for levator scapulae. So this is always a really productive place to go. You could do it with the ball in the sock. Okay, you could do it lying down on the floor with a ball in that place. I think that's the best way to do this one trigger point, because you can relax into it, you can float the arms, you can move your head and neck. Maybe just make sure your pillow's there for your neck. Okay, so trigger point 1, you could grab your knobbler, you can get in there with your wooden tool. So there's no blood vessels here that we need to worry about. Okay, and it's always pretty, pretty active, that trigger point. So the second trigger point is, if you look at the neck, where the neck meets the shoulder, if you were to lift your arm up, you can feel the front of your trapezius, that first muscle group that we looked at. Just stick your thumb underneath trapezius, so you delineate between the layers. And then I want you to take 2 fingers, first and second finger, and just press into that space, pushing into the processes of your neck, and just move the fingers around, and you'll find tenderness in there. If you've got nails, try not to use let the nails dig in, try and use the pads of your fingers. And this is one place that you wouldn't go in with a knobbler, and you wouldn't go in there with a ball necessarily, because you've got nerves, you've got lymph nodes here. So you're just going to get 2 fingers, I'll turn slightly sideways, and you could be doing a gentle rub forward and back. You could be doing circles. Okay, you can change hands if you get a little bit tired. The opposite hand is much more effective. Okay, and it's light pressure. So when you're working on the neck, you're really about 1 or 2 out of 10 in terms of pressure. So when you're working on nerves in the fascial system, you don't need to apply a lot of pressure. And you're just massaging across the levator scapula, trigger point 2. So if you can get slightly under your trapezius, pushing into the neck. Okay. And then trigger point 1 is, if you come to the ear and the mastoid process behind the ear, if you come just below the mastoid process, so the mastoid process is that bump behind the ear, you're coming down, and with 2 fingers, again, just gentle pressure, 1 or 2 out of 10, and you're just rubbing across. So it can be quite tender when you get near the rim of the skull. Where these muscles attach, you can feel there's quite a lot of tenderness, quite a lot of activity here. So just 30 to 60 to even to 90 seconds. So I quite like, when I do this one, I quite like to hold my skull and use my thumbs. That's another way that you can do it. So it depends how much feedback you can handle. Sometimes it's better just to have a single side and let your brain just assimilate the information that it's receiving. And if you get to a point where you get quite used to this, then you can go to the double circles with your thumbs, add a swallow. Okay, so this area is quite an active area because you've got quite a few muscles coming into this place. It's pushing. So remember, this muscle attaches into the first, second, third, and fourth cervical vertebrae. So you're sort of pushing into the processes that come out at the side of the neck. Okay. So whenever we're here, we're not really in the place of the jugular and the carotid artery. That's more forward at the front of the neck. But, you know, if ever you feel a pulse in the neck, you're in the wrong place, stop straight away and go and look at, you know, go online and do a sort of a video search for where the blood vessels are in the neck so that you're very aware of what you're avoiding. So trigger point 1, at the angle of the scapula, the shoulder blade. Trigger point 2, where the neck starts to level with where the shoulder meets the neck. You lift the trapezius up, you're getting slightly under the trapezius, you're pushing into the neck, little friction rub, and then level the trigger point 3 just below the mastoid process. So again, stop the video, do the other side. And again, as you're going along, just assess, you'll feel that the neck starts to feel really lovely as you do this. So the main 2 muscle groups to look at when you've got neck stiffness and neck pain are trapezius and levator scapulae. Moving on from that now, we'll look at the sternocleidomastoid, which is the muscle at the front. And if you think about, you've got your collarbones, you've got your sternum, you've got your mastoid process, so that gives it its name. It originates at the sternum, it connects to your collarbones, cleido, and finally attaches to your mastoid process. So sternocleidomastoid. It's if you look at the neck, you can see there's a V shape at the front of the neck. And if we get angry, you can see that muscle bunch up. If you turn your head to the side, you'll see the muscle become very active. So that's what you do to find the muscle. You look away from the side that you're working to find the muscle with the hands. This muscle group, it comes up and then it forms like a cap on the skull. So if you think of like a hat or a cap, then you can get a better picture. A good picture I always think is if you've got a plastic shopping bag and you put it on your head and you pull the handles down to the front a bit, you know, that would give you the sphere and influence of this muscle group. And it's a little bit like the reins of a horse. So if you pull back, tightens. If you pull to one side, you pull to the other side. So it sort of acts like reins on the fascia that covers the skull and just gives you really good support in the front of the neck. So when we work this muscle group, we've got to be careful of the blood vessels. So if you feel the bones at the front of your neck very gently, if you dig your fingers slightly in, you'll feel, so be gentle, you'll feel there's a pulse under the finger. So we've got the carotid artery going up and we've got the jugular vein coming down here. We've got nerves, we've got lymph nodes. So always very gentle in this place. And the rule is when you're working on areas with blood supply, you only, especially the neck, you're only working on one side. So that if you did it wrong and you were cutting off the blood supply in any way, then you know you've still got good blood supply through the other side. If you feel slightly nauseous or dizzy, you stop this straight away. So think about making a circle. So with your thumb and your first finger and your second finger, you're making a circle. And you're only ever going to use pressure of 1 out of 10 in this place. So very gentle pressure. If your fingers sort of flatten into this, you're going to be using too much pressure. And you're always slightly, so you're always using your opposite hand and you're always working outwards. You're not pressing downwards and backwards into the blood vessels. So you're going to turn your head, so we're working on this side, turn your head away to look to the opposite side. Push your thumb against where the sternum, breastbone, and the collarbone, right at the very beginning, where you feel that muscle begin, and then make your circle with your first and second fingers. Look forward again, and your thumb is pushing outwards, and you're just gently squeezing with your circle So you've got trigger point 1 here. So the thumb is pushing to the side. So there's no downward pressure on the blood vessels or the nerves. The fingers are gently milking. It's almost like you're milking a cow, but you've got your circle. Make sure the fingers are not flattening, too much pressure. And just gentle squeeze and release, squeeze and release. So the squeeze and release is a good way to go, because then, you know, you're not pressing on the blood supply. It's intermittent. And maybe you do about 10 in each trigger point. So trigger point 1 is just where the collarbone comes into the breastbone, right at the very beginning of that muscle. Trigger point 2, I'll turn my head to the side, is about a quarter of the way up. So you push your thumb into the muscle when it's lifted up, you look forward again, you've got your nice circle with your first fingers and your thumb's pushing outwards, gentle milking. The thumb is never pushing down into the neck. If you can feel a pulse, you're doing it wrong. And again, go away, find a video on the blood vessels into the neck. It only takes a minute, and just really educate yourself as to where those blood vessels are, so that you can really visualize what you're trying to do. So, you know, of all the places in the body, this place can be the most, carries the highest risk if you do it wrong, but it also has huge benefits if you do it right. So sternocleidomastoid is about 10, feeds pain into the head, causes migraines, cluster headaches, TMJ in the jaw, pain behind the ear, pain in the ears, toothache, visual disturbances, balance problems. So has a huge effect, but is very rarely felt in the neck. You don't notice that the sternocleidomastoid is painful, but it's feeding pain through that sac of fascia that covers the head. It's almost like a helmet of fascia into the brain and into the head. So you've got trigger point 1 at the collarbone, quarter of the way trigger point 2, next quarter up trigger point 3. So that's your 1, 2, 3 points. So it's about a quarter each time. Turn your head away from the side that you're working. Hook your thumb against the sternocleidomastoid. Get your 2 fingers on the other side, looking forward. The thumb is pushing to the side, so I can't emphasize that enough. And you're gently milking. You've got the circle. You're not squashing those fingers down and creating too much pressure. So this muscle, you would never ever use anything other than your fingers. So no balls, no nobblers. 1 out of 10 in pressure. So you're really talking to the nerves in the myofascial system to let go, to release, to allow the blood and the lymph to flow again through these muscles to balance. So about 10, and then stop. So the fourth one is, again, it's just, if you look away from the side you're working on, feel the muscle where it attaches into your mastoid process, that bump behind the ear, comes slightly down, and you'll feel this really thick band of muscle there. And you could try the circle and see if you could just gently squeeze. So 1 out of 10, you're not pushing down. I find it quite difficult here because it's very strong muscle here. So what I tend to do is switch to 2 fingers and just do the little friction rub. So it's up to you. You could do the circle, the milking. Keep it a circle, don't let it flatten. Or do your little gentle rub. About 10 times. So again, little and often, and you'll start to notice that your neck feels very different. I mean, if you stop now and feel, close your eyes, you can feel very different in the side that you've worked on to the side that you haven't addressed yet. So again, you would stop the video and you'd repeat those 4 triggers just at the beginning of your collarbone. Turn your head away to find the muscle. You see it jump up. Trigger point 1, a quarter of the way up, trigger point 2, another 3/4 of the way up, trigger point 3, and just below the mastoid process, you feel the muscle there, trigger point 4. So little and often, even if you just did a little gentle rub through the day, you're going to find that even that makes a difference. So little gentle rub, just be careful of your blood vessels. So the next muscles are the muscles in the back of the neck, splenius capitis, and if you just feel with your hands at the back of your neck, find the rim of your skull, and then just feel those big strong muscles either spine of your vertebra in your neck. These are your capitis muscles. So I always think of them as like guide ropes on a tent that are really holding, like tensile steel, holding the neck up while it moves around. So, you know, just find your capitis muscles. And for this one, you want to come down about 2 fingers. And there's different ways you could do this. You could just apply pressure with your fingers. There's a pressure point about 2 fingers down in the deep part of the muscle here. But I find a better way to do this one. Like here, there's no blood vessels you need to worry about. You're never going to put anything hard on the vertebra in your spine, but either side you've got that. So capitis means bandage. It's like a thick bandage of muscles that comes down, you know, it's probably, you know, about this big, coming down at the back of your neck. So your 2 fingers down in the muscle. I want you to make a sort of a pincer hand. So you've got your thumb and your first and your second fingers together. So it's not the snake bite where you've got the separate fingers. You've got your first finger and your second finger together. You're coming into sort of a C, like looks like a capital C. And you're going to put your thumb at the back of the neck and your fingers on the other side. So your thumb's on the capitis muscles on one side, about 2 fingers down from the rim of the skull, and your 2 fingers are on the capitis muscles on the other side. And then put your hands on your forehead and try and apply equal pressure, pushing with the thumb and the fingers and pushing the hand into the forehead. So it's an isometric press, and you should feel with your thumb, especially the thumb, you should feel that active trigger in splenius capitis. So you're just pressing. It's not a huge effort, it's just enough to feel the pressure on the trigger point, and you want to be about a 6 out of 10. So that would sort of tell you how much to press. So you're just pressing 30 seconds, your hands will get a little bit tired, your arms will get tired from being held in this position. So you're just pressing and holding with this. If you wanted to, you could do a minute circle with the thumb. You could move your head a little bit, but I find just holding still is more than adequate. And again, you'll feel the muscle yield, and you'll feel that you're getting deeper and deeper into this trigger point. Gently release. So then make your C on the other side and use your thumb on the trigger point on this side. Add your pressure on your forehead. So you usually notice when you do this that one side is a little bit more active than the other. That generally applies with the neck anyway. Usually whatever habitual problems and patterns that you've got that are causing problems, you'll find that it's affecting one side primarily. So my example is I've got a really healthy neck. I've got nothing wrong with the vertebra or the discs in my neck, but I tend to sleep in a certain way on my left side, which means it tightens up my neck and shoulder girdle on the left. So that is a habitual pattern that's causing problems for me. And I do it because of my spine, but it's something I have to manage and keep an eye on. So you could just do those 2 triggers, 2 fingers down. But if you think about it, we've got 7 cervical vertebrae. So where we're pressing is about C3. So we've got 2 above there that go into the skull. And then you could come down C4, C5, C6. And C7 is taking you into the back of the shoulders. You can tell where the neck vertebra changes into rib cage vertebra, because as you come down the back of your neck, you'll feel there's a really big vertebra, and that's your first thoracic vertebra. So that's called your CT junction, your cervical thoracic junction. So, you know, you're just above that big vertebra If you count with your fingers, you can work your way up. You've got 7, 6, 5, 4, 3, 2, and 1 is right in the back, underneath into the skull. So, 1 and 2, you can't quite get to 1 and 2, they're right up into the, so you're really focusing on 2, 3, 4, 5, 3, 4, 5, 6, 7. So you can come down the neck, just explore if there's any other triggers in the capitis muscles. Okay, there's smaller cervices, capitis, and smaller muscles in this group as well, but we're just going to do an overview because it would take too long to do them all, and we're just getting you started with your trigger points. So finally, we've got the scalenes, and the scalenes are in the sides of the neck. The scalenes, they feed pain downwards, so they're feeding into the chest because they're attaching to the ribs, so they're breathing muscles. They're feeding pain into the upper back and into the shoulders, sometimes into the arm and sometimes into the fingers as well. So sometimes you'll feel this in your little finger and the next one in. So all through this line feeds into the scalenes. So there's quite a few triggers in the scalenes. So what we're going to do is just a very simple addressing of the scalenes, and we could come back to that in another workshop when we're looking more at shoulders and arm pain. But we're just going to get 2 or 3 fingers, and you're just going to do a gentle, so I think 1 or 2 out of 10 in terms of pressure, just a gentle friction rub across the sides of the neck, coming up to the underside, the rim of the skull. So even just a gentle rub is going to make a huge difference. So it's quite involved to do the scalenes as you come closer to the collarbone. You're getting near to your subclavian nerve and blood vessels. So we're not going to go in too close to the collarbone. We're going to stay in the midsection, up towards the skull. Friction 1 out or 2 out of 10. And it's just a rub. So it's going to improve your circulation, your lymphatic drainage in this area. Maybe a little bit of a tension under the skull there. So if you were to lift your arm up, find your collarbone, find your trapezius, there's a little indentation in there, and you could get 2 fingers and you could just gently rub downwards. Make sure that you're comfortable. So only 1 or 2 out of 10. Okay, we'll do the other side. So you're in the mid-range, or halfway up the side of the neck. Use 3 fingers and you get a nice broad coverage, and 1 or 2 out of 10 in terms of pressure. You're nowhere near the blood vessels at the front of the neck. You're in the side of the neck. You're coming up towards the underside, the rim of the jaw and the skull, the mastoid process. So it feels pretty tender because I'm on my left side. So as you do these classes, you're going to really start to build quite a good picture of what's happening in your body. You become your own expert. You can take care of your own body. You're the best person to do this because you can feel through your nervous system exactly what's going on, how much pressure to use, where those points of tenderness are, and manage it. So if you're doing this little and often, you're not going to get to that point where you go into that horrific, chaotic crisis where your neck is completely locked, or you've got the frozen shoulder, or whatever. You can really deal with this as you go along. Okay, you're lifting the arm up, you find your collarbone, okay, and you find the back of your trapezius, and you're just going to come into that little indentation. So these muscles attach to the upper 2 ribs in the rib cage. So this is where you're going now. Once you've found it, you can relax the arm. You're slightly pushing backwards into that little groove between the trapezius and the collarbone. 1 or 2 of pressure, don't go too hard. Especially guys, you tend to think more is better. And when we're dealing with the nervous system and the myofascial system, less is more. So gentle, you're sending messages through the nervous system, relax, let go. Using brute force is going to send, defense messages to the nervous system, to the brain, and be counterproductive. Okay, so just roll your shoulders, move your neck, just see how that's feeling. So we just finished with coming back to the sternocleidomastoid. We think about that helmet of fascia, and we're just going to make a sort of a clawed hand and just use our fingertips to massage our scalp. So healthy fascia, superficial fascia, should glide over whatever is underneath of it. So the superficial fascia is like a wetsuit of the body. And when we're born, it perfectly fits the body. It has glide and movement. But as we get older, as we get injuries, as we get stressed, we start to lose the glide. And then we start to get restrictions, impeded blood flow, impeded lymphatic flow, start to get into problems. So you could do the mastoid process with your thumbs behind your ears. You could do the suboccipital muscles, the muscles at the back of the skull on the flat plane behind that round mound of the skull. So I've done other videos on the vagal nerve and how to release the top two vertebrae in your spine by just massaging your suboccipital. So that's another video if you want to go away and find that one. The temples with the fingers, we intuitively do this when we're stressed, when we've got headaches. Okay, so the sternocleidomastoid, through that helmet of fascia, is really giving us cluster headaches, migraines. A nice gentle rub. So head massage, all ladies know when we go to the hairdressers and we get that head massage, how delicious it is and how great you feel afterwards. The forehead, so this helmet of fascia comes right the way over, even to the forehead. The jaw. So TMJ, when you get the temporomandibular joint pain, can be to do with your sternocleidomastoid. Again, that's another class. Open and close your jaw. Under the chin, under the jaw, there's lots of little lymph nodes here. You don't want to be too rough, but you're just going to get your thumbs underneath. And then you've got your, if you put your thumb under your chin, you've got your digastric. It's a muscle that makes up the underside of your mouth. So you just, with your thumb, you're just doing some little circles. Push the tongue into the roof of the mouth and just do a swallow. You start to feel the connection with those muscles. And just relax. So you should be feeling nice and warm and nice and glowy through all those muscles from about here upwards. Just turn the head right to left. Do some shoulder rolls. So these classes are really pick and mix. You're going to watch all three. You're going to pick out the bits that apply to you and find your best protocol for you to take care of your own neck. So going on to the next one now, we're looking at Pilates, Feldenkrais, and Franklin method for the neck. Some massage techniques and movement therapies just to keep your neck strong and flexible and stable. Well done.